So now we're going to show you how to put on a lumbosacral orthosis or an LSO on your patient. This is used to stabilize the spine before movement. So Brian, this is going to be a brace that's going to protect your trunk. It's going to fit really snugly over your pelvis and it's going to come to underneath your rib cage. There's a couple of things to keep in mind when wearing this. It's to prevent any bending, lifting, or twisting. So just remember BLT. In order to ensure that he does not break those precautions, we're going to be applying this in supine or lying flat using log rolls to make sure the spine is one unit. And Sid's gonna help me out. So the first thing we're gonna do is roll Brian towards me so that we can place it underneath his spine. All right, Brian? So you can just look over my shoulder and I'm gonna roll you towards me. Good. Keeping that spine nice and flat. Sydney's gonna tuck it in underneath his iliac crest, and then we're going to roll Brian back, and then Sydney's gonna roll Brian towards her. And I'm going to pull it out the other side, making sure it's in place, and then he can go back flat. Good. Yep, now you can adjust it when they're in this position so that it fits exactly where you want. So now that Brian is lying flat and he has the orthosis in the correct position underneath him, we're going to just make the straps nice and tight. They need to be really secure so that when he is walking later, he does not have any unwanted movements of the spine. So I'm just gonna tighten these straps. And then to tighten this one, we're just gonna have to log roll Brian. All right, so Sid, if you could log roll him towards you.
You can look towards me.
Good. I will pull it tight behind him. And then he'll come back flat. Beautiful. And that's how the LSO fits. And same thing we were doing this entire time. In order to get him up to a seated position, we would use a log roll. We wouldn't raise the head of the bed because we don't want him to bend, as we said before.